that you were able to join us. We really wanted this just to be a touch point to connect with you and to share a little bit about what's happening, and mostly just to let you know that we're thinking about you. But as we get started, what I'd like to do is just do a bit of a prayer. And what I'm going to do is read a prayer that was written by Thomas Merton. And it came out of something that he's written called Thoughts in Solitude. And for any of you who may or may not know about Father Merton, in his autobiography, The Seven-Story Mountain, he tells his story of being a layperson who goes into the priesthood and actually becomes a Trappist monk. And that story is one of his personal experiences through sort of being in the world and then having the world taken from him and being sort of isolated. So I thought it was quite fitting. And it's really a beautiful prayer. So I'd like for us just to bow our heads, close our eyes, and take a moment while I read this and pray this with you. My Lord God, I have no idea where I am going. I do not see the road ahead of me. I cannot know for certain where it will end, nor do I really know myself. And the fact that I think that I am following your will does not mean that I am actually doing so. But I believe that the desire to please you does in fact please you. And I hope I have that desire in all that I am doing. I hope that I will never do anything apart from that desire. And I know that if I do this, you will lead me by the right road, though I may not know anything about it. Therefore, will I trust you always, though I may seem to be lost and in the shadow of death. I will not fear, for you are ever with me, and you will never leave me to face my perils alone. Amen. So as we're getting started here, what I'd like to do, so I'm Vince Salyers, I'm Dean of the School of Nursing and Human Physiology, and we have a number of our leadership team members on the line with us or participating in this webinar. So perhaps what we could do is have you each introduce yourself. Maybe we could do that.
Sure, I'll start. Hi, everybody. David Thorpe from Department of Human Physiology. I'm the department chair there. So I'm looking through the attendee list. I see a few of our students there. So if you have any questions, just let us know. Thanks.
Jane Teed. Oops.
Go ahead, Jane.
I'm Jane Teed. I'm the Associate Dean for the Graduate Nursing Programs.
I'm Jennifer Towers. I'm the Assistant Dean for the School of Nursing and Human Physiology.
I'm Jonah Owens. I'm the Associate Dean for the Undergraduate Nursing Program.
Did we get Scott? Is Scott there?
Scott is not on.
All right. All right. Well, Scott Petty is the director of our nurse anesthesia program. So at any rate, what I'd like to do is just to talk a little bit in general about what has been happening. And certainly we have all understanding of all of you, and that you're coming from different places, different states to join this meeting. And certainly as students across all of our programs, you come from just a huge and wide distribution of areas. And we can't even possibly begin to know what you're facing on a day-to-day basis. We certainly know that you have life experiences and things in your own communities that you're facing. We know that some of you are actually working on the front lines through this pandemic, which is unprecedented. And we know that that comes with its own set of victories, but it also comes with its own set of challenges and opportunities. So first and foremost, let me say thank you to all of you who are working on the front lines in whatever capacity. And that might be in hospitals, it might be in clinics, it might be in grocery stores, it might be in pharmacies, wherever you are, and in whatever ways you are reaching out and helping in your communities, thank you, because we know that you are critical to all that's going on right now. We also know that things in the landscape in every state are different in terms of the pandemic, in terms of exposure, in terms of positive cases, in terms of actual diagnosed cases, people with symptoms, people without symptoms. I've even heard from students and faculty and staff that even perhaps in your own homes, you have individual circumstances, people who may have loss of income because of jobs, because of spouses and or significant others and loss of income. And I guess the first thing that I'd like to say about that is our hearts go out to you because this is something that is just devastating and there is no way around it. It is devastating for all of us. In all of our experiences, we all are just trying to first and foremost get by and do the very best that we can given the cards sort of that we've been dealt. And that landscape is more than likely going to continue to change. And one of the things that I hope in all of this is that you continue to reach out for all available resources that you have to you, whether that's in your own communities, through your churches, through your personal networks, through your sphere of influence and or your coworkers and your colleagues and that kind of thing. We all are in this together and we have to approach it from that place. Certainly, we've been at the university involved in critical discussions about the best ways forward for all of our students. And as you might imagine, those have been very difficult discussions. There have been countless hours with faculty and staff and administrators at the university trying to make sense of all of this. Trying to think through the implications from decisions that might be made, to thinking through ways forward into the summer and into the fall and beyond. And again, there's so much unknown that some of those discussions are really challenging because we don't have enough information. And one of the things that I wanted to share with you, just as a bit of context, is that we again, certainly in the School of Nursing and Human Physiology, have tried to take a very fulsome and comprehensive look at what's been going on. So I'll give you some examples of the levels of discussion and the layers of complexity, just to create a bit of a context for you. When the pandemic first kind of took off and launched, the Jesuit Deans of Nursing, for which I'm part of that group, we began to have discussions and come together really just to hear what was going on across the country and to have a bit of context about ways forward and some of the decisions we were contemplating. And through those very early discussions, it was becoming very, very clear very early that universities were being faced with whether or not to continue in face-to-face formats, and were very much considering moving courses to online formats. And again, that was very early in the discussions. And we were hearing that for students who had practica and clinical courses, that some of those agencies were actually beginning to think about restricting student access and that kind of thing. So we have certainly remained in contact, the Jesuit deans and I, and in those discussions, I would just reassure you that we continue at Gonzaga to be aligned with the practices and the things that are happening across that landscape. Another discussion, or series of discussions, I should say, has been with the deans and directors of nursing statewide. As you might imagine, there have been lots of discussions about how best do we support our students to progress as seamlessly as possible, given some of the challenges that we currently face. And so those discussions have led to some, I would suggest, outside the box and innovative thinking that continue to work their way through statewide systems. Some of those innovative discussions relate to the use of simulation, and having simulation offset some of the hours that may not be undertaken in clinical agencies for which we don't have our students currently engaged. To discussions of really assessing student competency and readiness to practice, and perhaps looking at a relaxation, if you will, of clinical hours, particularly at the undergraduate level. But again, those are still in exploration. No decisions have been made about that. But really trying to look at how do we allow our students to move through, particularly those that are ready to graduate, in ways that allow them to get out into the workforce and start working. There are greater complexities when we talk about our graduate nursing students because of some of the accrediting bodies and national messaging around required minimum hours for nurse practitioner students, for example, how simulation and virtual simulation might be utilized for hours that are above a minimum. And again, I think those discussions continue. And at Gonzaga, with our program faculties, both at the undergraduate and graduate level, we continue to talk about and grapple with the best ways forward for our students. For all of our students in all of our programs in the School of Nursing and Human Physiology, we have had to sort of think through, in the first instance at the undergraduate level, how do we now move courses to an online format when we've not done that at the undergraduate level? And we hope that you understand that we've done our level best to migrate those courses over in very short order. You know, students were out on spring break, and of course coming back, we were thrust right into the middle of now moving into an online format at the undergraduate level. And that's been challenging for sure. But from my perspective, our faculty in human phys, at the undergraduate in the BSN program, I think they have done just exceptional work to make those online courses happen in such a short amount of time. And so we want to continue to please have you understand and be patient for some of that transition, because it's a work in progress. But I do believe that our faculty and our staff have worked countless hours to make that happen for you. And we hope that your experiences demonstrate that. And we know that they'll only get better as we become more adept sort of in online learning formats and the utilization of technology where we've not always used that at the undergraduate level. At the graduate level, of course, we have done much more of our coursework online. So that transition has probably been less challenging, where it's been really, really challenging for us, and we've had to really think about how to move through immersions, for example, and virtual immersions, and ways to conduct our OSCEs and some of those learning activities in ways that have been face-to-face that we've now been asked to do in an online format, or in a virtual format, I should say. So those are some of the things that I guess I just wanted to share with you. The other thing that I wanted to mention, because I think it's really, really important, is that as we've had to move into this virtual format for our courses, communication has been really, really critical. And in some cases, that communication has had to be forthcoming a bit later rather than sooner. And we can only understand the angst that that must cause you all, because you have lives. We understand that. You want to know what the future holds and how you're going to be moving forward in your programs and in your courses and that kind of thing. But we would also hope that you have an understanding, particularly on the nursing side, that we've had to work with our regulatory body, the state body, and in many instances, we've submitted substantive change requests to the regulatory body, and that's taken some time to get back in terms of approvals to move forward with particular options and phasing and or learning strategies and those kinds of things. So it's not that we didn't want to share the information, but we wanted to be able to share that information with you when it was available and when it was approved by our regulatory bodies. And at least in one instance, that approval didn't come until Friday evening of this last week. So again, we do understand the stress and the anxiety that this may cause. And we hope that you would understand that we've tried to be as communicative as possible with the right information when we were able to share it. Now, have we gotten communication 1,000% right? We can always do better in our communication. So we will continue to communicate to the level best of our ability. And make sure that you have access to the information and resources that you need to make decisions on a go-forward basis. And again, I would ask you in the first instance, when you have questions that are program specific in particular, that you start with your chairs, your directors of your departments, your program faculty, your associate deans, because they're the individuals who have their fingers on the pulse of the most up-to-date information, and they're the ones with the program advisors, the coordinators, excuse me, who are going to be able to help you make informed decisions. So at that point, I think I'll pause for a minute and maybe ask, do any of the chairs, directors, or associate deans have anything that you might like to add before we maybe open it up for a bit of discussion and that kind of thing?
I just want to thank everybody for their patience and understanding as we've worked through all of the logistics of canceling summer classes, suspending clinicals. As soon as we are able to put students back in clinical, we will. We recognize that has, for a lot of students, delayed your progression plan up to a semester. And we did that with much reluctance, but after much discussion and deliberation, really saw no way forward other than to cancel the classes that we did cancel this summer. So Rachel Young is working on progression plans. We've provided a link to provide you an opportunity to ask questions about your progression plan so we can work through those, and we just appreciate everybody's patience and understanding.
I'll just second that. We do appreciate your patience. We know that this has been frustrating as you aren't always happy with the changes, but please know we thoroughly discussed and looked at every angle for all these decisions, and that we do have your best interests at heart.
I'm just trying to look through a few of these questions here. Dave, any thoughts about human phys and for the few of your students who might be online?
Nothing really in addition to what we've communicated them. We obviously, I hate to call our situation simple, But it's obviously not as complex with required clinical hours and being in healthcare facilities and such. And so in that context, our response was really quite simple. We just needed to shift everything online. And of course, I invite students, if they've got questions or concerns about the way those online courses are going, or how that might transition the next fall, to obviously just reach out.
Mm-hmm.
There's a couple questions about the IPs for the nurse practitioner program. So for students that will be taking their that are in or taking their last clinical courses, as soon as students are able to finish out their clinical hours, if they get an IP, then we can process that and post grades. I know the university posts degrees at least twice in the summertime and twice in the fall. So we're trying to work with the registrar's office to get things expedited so that you can move forward with processing the paperwork to take your certification exam. And my understanding is talking with Deb Smith is that as soon as you've completed your clinical hours, even if the paperwork hasn't been finalized for the IP grade, converting to a grade, you can still start the paperwork for the certification exam. So we are hoping that there is going to be opportunities not to have to wait until the very end of the semester to graduate. And that was kind of our plan, as we would process those as soon as possible. For students that will be taking an IP at the end of this semester, my understanding is that the NP faculty plan to be available this summer, so that as soon as you're able to get back into clinical, you'll be able to finish out those IP hours and grades this summer so that you can progress to the next course by fall. So I'm hoping that answers a lot of those questions.
One of the things that I hope all of our students would absolutely trust and understand is that these have not been easy decisions for any of us. Again, within departments and program faculty, and through the many, many discussions, no one would want students to have to delay their programs. And it's been our hope and desire to ensure as much as possible as little disruption to programs and to student progression as possible. But as you're aware, there is so much uncertainty. So we've always come at it from a place of student and staff and faculty and patient safety, as well as your own safety. Because again, there are so many complexities to this. Students across 10 state geographic distribution, working currently, and possible exposure for which you may or may not know that that's happened. And the possible exposure of our communities and our patients and others in the communities, and all of those kinds of things. It's not been an easy discussion, and it's certainly not one that we take lightly, but we've always framed it from that place of safety, both your personal safety, safety to the public, and ensuring, most importantly, that we hold to program standards, and that we're making sure that the individuals who are going out into the workplaces are prepared to do so, and are safe to do so. That's also been critical to all of our discussions. But we have not in any way tried to minimize any of that as we've had these discussions. We really want to do what's right, and do what we can to make sure that the students, you students, are supported and are able to move through to the best of your and our ability.
And I'm trying to reply to some of the questions in the chat box as well.
Mm-hmm. One of the things that you might be wondering about, and again, we don't have an answer yet this moment, but it is something that the university has been in discussion about, and that is when might face-to-face courses resume? And there isn't an answer to that at this point, given sort of the governor's proclamation in the state that has sort of extended out the stay at home thinking, social distancing, and those kinds of things. That goes out till at least the beginning of May. And so the university continues to grapple with how early might we bring students back, or are we able to bring students back? And again, there's just not information at this point. So from our perspective in the School of Nursing and Human Physiology, I would continue to suggest that online learning and Zoom and our technology will continue indefinitely until we know otherwise. I think that is just our best thinking in terms of programmatic options and offerings and that kind of thing. How are, for the students who are online, how are you experiencing the world? What are things like in your area where you live, and as a student, how is that going for you? Because we do want to hear about that as well. We want your experiences to be positive ones. We want them to be the best possible given the circumstances that we've been dealt. One of the sources of feedback has said that the immersions, the Zoom online immersions, have been very positive. I wish future immersions would also be conducted remotely to cut down on travel costs. That would be a discussion that I think that the NP faculty and or the department would want to have to make sure that, again, the experience as rich and as robust as possible while being able to ensure that competencies are being met and that kind of thing. So again, it's something for us to think about. It is something for us to consider, and I'll certainly let Jane and group take that back for some more consideration. One of the questions asks about Gonzaga and helping NP students to find new clinical placements if they lose their pre-scheduled placements because of the progression delay. We realize, and again, I wouldn't be the best expert on sort of answering the question, but we have, for as long as I've been the dean at Gonzaga, been discussing how do we make sure that we have robust clinical experiences, particularly for our NP students across this 10-state geographic area. So we've been looking at ways to ensure that we have sufficient clinical placements, that they're quality clinical placements, and we continue to explore the means for being able to do that. And we will continue to do that for sure, because we know that, of course, as things will never return to normal. We sort of talk about returning to normal, but I don't know that we'll ever have a normal. It may be a new normal. But we realize as more things get back to a steady state, that all kinds of students, undergraduate, graduate, medical students, healthcare students, just all kinds of students are going to want practica. And this is going to take some systems coordination, and it is going to take some work for us to sort through that with students. And we are looking into some opportunities to enhance clinical placement coordination and garner some additional placement opportunities for our students. We're looking into that. I know that's a bit vague, but perhaps some of the others might jump into that discussion.
I can speak to that a little bit, Vince, about what we're doing administratively in the clinical placement area. So many of the graduate students know or have spoken to Shannon Emery and Susie, and we are actively talking to vendors. We're talking about our own internal systems, and we're taking your feedback very seriously. With all of the new burden that's placed on you as students, given the pandemic and trying to catch up with your clinical hours, we are in talks every day about what it will be like for you and how responsive we can be for you when clinicals resume. And so it is on our minds. We talk about it every day. We're a little bit constrained, as Vince alluded to. We're in 10 states. We don't know your areas very well. And so we're trying to employ some outside help to get us more familiar with the types of clinical opportunities in your area. We have some really great clinical faculty that we work with across the states, and our faculty have also been very helpful. And we know that it's a struggle in normal times, and that it's going to be even more of a struggle when you get back to clinical. So although we don't have all the answers, we really are actively working on it, and we really would like some input from you as to what you would like to see and what you would expect, so that we can use that as a framework for our discussions.
Mm-hmm. One of the comments that's been made, and it's from my perspective always about trying to celebrate the positive and celebrate the yays. And one of our students has said that they've appreciated the flexibility that has been provided for due dates and things like that, because in this particular case, this student is providing direct patient care on the front lines. And given the extended hours and the long hours and that kind of thing, the flexibility has been really, really tremendous. So thank you for that comment. And yeah, it might be good just to pose your questions so that they can be seen by everybody who's participating. I think some students haven't connected into the direct chat and have made that open so that everybody can see the comments and some of the questions. And we do want to make sure that you all are seeing what everybody is asking, so that you have a good understanding there.
There's several questions about if we continue to suspend classes with that. Are we potentially looking at canceling classes in the fall as well? And as far as I know, all of our conversations our hope is to resume classes in the fall, with however that proceeds. I don't know if you have any other insights.
Yeah, again, I think, for example, Gonzaga has made the announcement recently of convocation. So I believe that all hope would be that we would resume campus-based kinds of activities by the fall. And we can only hope for that, right? And if all of the projections and all of the sort of modeling and forecasting hold true, then the likelihood of that is probably pretty high. But until we're closer to that time, it's really hard to say. So again, I would suggest that from the School of Nursing and Human Physiology perspective, we sort of plan for, in the short term, certainly through summer, to prepare for online courses, and then as we have more information about face-to-face and or other clinical opportunities and that kind of thing in the fall. We'll just have to keep messaging as available information is there.
I had another question about the IP grade, and the goal is if you can finish your IP within the first week of the next semester, then you could progress to the next class. That's for summer school. I think we talked about maybe giving 2 weeks into the fall because that semester is 16 weeks versus 14 weeks. So for fall or for summer, the plan is definitely if you can finish your IP within the first week of summer session to advance into adult Gero 2, then you could progress on. For fall, we'll look at that and then give some more direction this summer. So we are continuing to have discussions. We've put a task force together to look at telehealth or telemedicine. In the future, if we do go that route, it would be in a very limited capacity. We do have several of our practitioners who do utilize telehealth on a regular basis, and there's a lot of policies and procedures, equipment that has to be in place, but other NP faculty are doing telehealth, and it's usually over the phone and just is not a good learning experience for the student. It hasn't worked well for the practitioners either. It's more of a quick triage, and so that's part of the reason why we've not looked at telehealth, but we will look at that in the future and are hoping to have some policies in place by this summer.
One of the questions really is about sort of students who are close to completing requirements and being able to graduate. And what I would say very generally, and this would be true of all of our students in all of our programs, faculty and staff, I think, look very carefully at each student's circumstances, look at how best to support them through progression to graduation and or to next courses, and make really critical decisions about that on a student by student basis. And so it may not exactly look the same for every student. And so I guess I would just want you all to know that they are critically looking at progression and are doing their level best to make the right decisions for when and how students might progress, and if they're ready to progress. And I know, again, that's a bit of a vague answer, but I did want you to know that these decisions don't happen in isolation, and they don't happen in an arbitrary way. They're made in very mindful ways of what is the best opportunity for each student to allow them and help them to progress so that they're successful. And we want all of our students to be successful, no doubt, bar none. And we do take all of those things into consideration when we are making decisions about how close students might be to graduation, how close they might be to meeting clinical requirements and otherwise. But as you might imagine, and what we would hope that you would understand is that it's not an easy decision. Yeah, so the comment that is worth a mention too is that all of our faculty and staff regularly have conversations and regularly work through numbers of scenarios, sort of forecasting and modeling. And those are the basis on which decisions are made about programs, about courses, course offerings. And the provost recently had asked all of the deans to consider, are there courses anywhere across curricula that might be offered, moved up, if you will, in the program plan, those kinds of things. And so we're exploring that. If there are possibilities to offer courses that we wouldn't traditionally offer in the summer. So we're looking at that. Not to say that there are any promises, but we're certainly trying to identify if there are means for us to sort of fill in the gaps during this time when regular progression may not be an opportunity or an option.
Somebody has asked about, given the uncertainty, is doing a didactic only option available until clinics are able to resume? And I think this would be something we would definitely look at in the fall if that was the case, that clinical sites weren't still not accepting students and that kind of stuff. So it was definitely something that we talked about and would consider in the future. Once again, all of these sort of decisions have to be vetted through our accrediting and certifying through the nursing commission, because it would be a deviation in our, a significant deviation in our curriculum. So.
Yeah, what I would just add to that, this is just a personal perspective, and I'll share it as a personal dean perspective. And one of the things across undergraduate and graduate nursing is this sort of thinking about paired theory, clinical. And there are reasons why the programs and the curricula have been developed that way. And I've been in other institutions where they've sort of been unbundled, front-loaded theory, then clinical, those kinds of scenarios. And they create their own challenges. I learned the theory about this thing over here, and then I don't apply it until I'm over here in this clinical situation. And sometimes students have struggled because of not pairing that theory with that clinical at the same time. So it is just something to think about. Sometimes while we may make some concessions in a short-term way to help students move along, those may not always be the best experiences overall, but it is absolutely, to Jane's point, something for us to consider and to think about, because again, we want students to progress in a way that is as seamless as possible, but that also creates success on your behalf. Any other comments or thoughts, or your own experiences, or just your own shared perspectives? So I think these last comments have been ones mostly of saying, thank you for flexibility. Thank you for understanding the multiple perspectives of students in particular who certainly want to finish their programs and graduate and get out into the workforce. That, coupled with the unique challenges and the uncertainty in the clinical areas and those kinds of things, I think I'm sort of discerning there some thanks for that flexibility and that kind of thing. And, you know, I guess if I could speak on behalf of our leadership team here, again, we want to thank you all as students for your flexibility and for your understanding that we're absolutely doing our level best to make good decisions, to make the right decisions, to make decisions that'll have the best outcomes at the end of the day. And while that may not always seem visible, thank you for your patience. Thank you for your understanding. Certainly, thank you for, in particular, your patience when we've had to move to online formats, when we've not traditionally done that. And again, thank you for your patience through communications, understanding that countless hours of discussion at the university level, at the state level, at the national level, accreditation level, regulatory body level, program, faculty, staff. Again, you can only imagine the complexities and the need to make sure that we were communicating evidence-informed information to you at the right time. And sometimes it's hard. We all understand how hard it is to do the wait and see, wanting to know how this is going to impact my future as a student. And we say thank you to you for that understanding and for that patience with us as we've had to move through these various levels of complexity and of discussion. We are so thankful for you. Please know that. We want the very best for you in terms of where you live right now, today, where you're practicing, where you're working, as well as for your safety and the safety of others. So unless anyone has anything else to add, that might be, I think, a really good place for us to end. Certainly, I want to mention one more thing. There still are online and phone resources available to you through Gonzaga. Cura Personalis office and student services have any number of supports available to you. And I would just like to mention those to you again. The Office of Mission and Ministry has created some opportunities virtually to help support you, to pray with you, to take those kinds of requests and move them forward. So please know that they exist. And again, as you have course-specific, program-specific information, please start with your faculty, your staff in the program areas. Talk with your chairs, your directors, your associate deans to try to get the information that you feel you need to have to make the right decisions. Sometimes the answers may be, we don't know yet, and we would ask that in those cases for the grace from you to be able to answer that way until we have more information. And with that, I guess, be safe, be well, and be filled with all grace. So thank you so much for sharing your insights. And
one more, can we do one more question?
Oh, absolutely.
Joan, do you know anything about pinning?
Actually, we just started discussions about pinning. There should be a survey coming out for those that this applies to. Amy's going to send out a survey with some questions that will help us plan that.
And a good point, maybe it's the last point, but it's just a reminder, and Jane had replied to one of the student comments. We are all in this together, right? It really, really does take conversations with you and with all of us together to make this work and to get through what is unprecedented, what is life-changing, no doubt. And we could never have imagined that we would be in this place, this moment today, having this discussion, but this is where we are. And certainly, I know all of us, all of the leadership team, we may have to make Dave an honorary nurse someday. But perhaps just the reminder that we are an International Year of the Nurse and Midwife. And while this may not seem like a celebratory year, it's all about us. It's all about what you're doing on the front lines. It's all about what you will do on the front lines in the days and the weeks and the months to come. And when you get out there, we hope that these experiences that have been shaped by the pandemic will shape you. Be blessed. Have a good day. Bye now.
You can't change.